Hey guys, welcome to 101nursing.com. My name is Priscilla, and today we will be talking about intra-renal failure. It's part of the acute renal failure. Again, acute renal failure is obstruction within, before, within, or after the renals. It's reversible, and it's very treatable if the proper dynamics are used. For intrarenal pressure, the causes of intrarenal pressure are ischemia or acute tubular necrosis. So within the tubulars, you have no perfusion or no flow of oxygen, causing ischemia or cytotoxic effects. So if you have drugs that are very cytotoxic, like your vancomycin, your gentamicin, your dyes, your chemicals like not freon, your antifreeze, or your metropanol, those are going to damage or really take a toll on the inside of your renals. Your heavy metals like your lead and your radioactive dyes, like that's why they ask if you have shellfish allergies or allergies to eggs, because that not only will that cause anaphylactic effects, but it also will cause intrarenal obstruction and damages. Glomerular injury, such as acute glomerulonephritis or post-streptococcal glomerulonephritis. So after a strep infection, you're receiving glomerulonephritis like a little gift or something. Uric acid, you have your crystals and your renal calculi, your gallstones, hemolytic reactions, or actual physical renal injury. You have vascular lesions, like various different types of lesions that occur. And when you're in this type of failure, these are your labs, your BUN and your creatinine are going to be increased. Urine is not really going to be moving. You're going to have urine decrease. You're going to have urine, your creatinine decrease, and urine specific gravity will either be fixed or high. So know these lab values. Your volume non-oliguric or oliguric, your osmolality will be low or fixed. Treatment for this area. You're going to need to avoid those nephrotoxic drugs. So if your patient is receiving vancomycin or any of the mycin family, and they have obstruction within their kidneys, we need to make incentive to the doctor and say, hey, or the provider, and say maybe this isn't going to be the best for the patient at the moment, or we're gonna just double up our I'm getting a lost for words, but we're gonna double up our medication. Yeah, that's what I meant. You're gonna treat the underlying cause. You're not just gonna say, oh, you're nephrotoxic because you have an infection. I'm not gonna treat your infection. You're gonna treat the infection. You're gonna minimize the or you're gonna prevent. You're gonna use your nursing judgment and prevent further obstruction. So minimum areas where you want to do is you don't want to give them too much water. You're going to have fluid restriction. You're going to have fluid restriction and supportive care if possible. Thank you very much. That is all.